Have you ever wondered what nasal polyps are or how they affect a person's health? If so, you're in the right place. In this video, we'll delve into the fascinating world of nasal polyps. We'll discuss what they are, what causes them, their impact on overall health, the areas within the nasal cavity where they can be found, and how we can prevent or shrink them through both natural and medical methods. So let's start at the beginning. Nasal polyps are non-cancerous growths that develop in the nose or sinuses. They're often likened to peeled grapes, and while they're usually benign, they can cause a range of issues if left unchecked. It's a topic that's worth understanding, whether you're a health enthusiast, someone dealing with nasal polyps, or just curious about the human body. Understanding nasal polyps is the first step towards managing them effectively. So let's dive in. So, what causes these unwanted nasal guests? Well, the exact cause of nasal polyps isn't fully understood. However, it's widely accepted that inflammation in the nasal passages often leads to their development. This inflammation can stem from several conditions, including chronic sinusitis, which is a long-term infection or inflammation of the sinuses, and allergic rhinitis, more commonly known as hay fever. Asthma, a condition that causes the airways in your lungs to become inflamed and narrow, is another potential culprit. The same inflammatory response that causes asthma symptoms can also lead to the formation of polyps in the nose. Recurring infections, too, are a common cause of nasal polyps. The constant cycle of infection and inflammation can lead to polyp growth over time. Similarly, immune disorders, where the body's immune system attacks healthy cells, can also contribute to nasal polyp development. This is because these disorders often cause persistent inflammation. Certain drugs can also cause irritation in the nasal passages, leading to nasal polyps. Aspirin, for example, can cause reactions in some people that result in respiratory symptoms, including the formation of nasal polyps. This is known as aspirin-exacerbated respiratory disease. Now, it's important to remember that not everyone with these conditions will develop nasal polyps. It's a combination of factors, including genetics and the environment, that determines who gets them and who doesn't. And here's an interesting fact. Nasal polyps are more common in adults than children. They're also more likely to occur in men than women. Though the reasons for this are not entirely clear, it's thought that hormones may play a role. In short, nasal polyps can be caused by a variety of factors, from chronic inflammation due to conditions like asthma and recurring infection, to allergies, immune disorders, and irritation from certain drugs. Recognizing these causes can help us in preventing the growth of nasal polyps. Now that we know what causes nasal polyps, let's delve into how they impact our health. Nasal polyps, while not malignant, can lead to several health complications that may significantly affect our quality of life. One of the primary concerns is the onset of chronic sinus infections. These persistent infections occur when polyps block the sinus passages, leading to mucus buildup. This environment becomes a breeding ground for bacteria, leading to repeated infections that can be difficult to treat. Another serious concern is the development of sleep apnea. Polyps can obstruct the nasal passages, making it hard to breathe during sleep. This obstruction can cause individuals to intermittently stop breathing during sleep, which can lead to other health risks such as heart disease, stroke, and daytime fatigue. A less known but equally impactful consequence of nasal polyps is the alteration in our sense of smell. The growth of polyps can interfere with the olfactory area in the nose, leading to a diminished or even complete loss of smell. And with the loss of smell comes a reduced sense of taste, which can affect appetite and enjoyment of food. The symptoms of nasal polyps are often mistaken for common colds. They include a runny or congested nose, facial pain or pressure, and snoring. However, these symptoms persist beyond the usual duration of a cold, often lasting more than 10 days. Nasal obstruction can also lead to mouth breathing, which can result in dry mouth and disturbed sleep. In children, nasal polyps may also be accompanied by chronic ear infections and hearing loss. The blocked nasal passages can interfere with the proper drainage of the middle ear, leading to recurrent ear infections and subsequent hearing issues. So, while nasal polyps themselves are not life-threatening, they can significantly impact our health and daily lives. They can lead to chronic health issues, disrupt our sleep, alter our senses of smell and taste, and even contribute to hearing loss in children. Though not life-threatening, the impact of nasal polyps on our health can be significant. Where exactly can these polyps be located in our nasal cavity? Let's delve into this. Nasal polyps typically originate near the top of the nose in an area known as the ethmoid sinus region. From there, They can grow in various directions, often towards the openings of the sinuses. The sinuses are essentially air-filled pockets within the bones of your face. They open into the nasal cavity, and this is usually where you'll find nasal polyps. They can occur in any of the sinuses, but are most commonly found in the maxillary sinuses, which are located in your cheeks. You may also find nasal polyps in the sphenoid sinus, located deeper in your skull behind your nose, or the frontal sinuses, which are in your forehead. Polyps can even form in the olfactory region, which is where your sense of smell originates. Their location often determines the severity of the symptoms. Finally, how can we prevent or shrink these polyps? It's a question we all want answers to, and the good news is there are both natural and medical methods at our disposal. First, let's talk about lifestyle changes. A healthy diet can play a huge role in preventing nasal polyps. Foods rich in omega-3 fatty acids such as salmon, flax seeds, and walnuts can help reduce inflammation. Also, staying well hydrated can keep your nasal passages moist and reduce the risk of polyps. Now, onto the medical methods. The first line of defense usually involves nasal corticosteroids. These are sprays that help reduce inflammation and can shrink smaller polyps. Examples include fluticasone, budesonide, and mometasone. It's important to note that these are not immediate fixes. They often require consistent use over several weeks to show their full effect. In cases where nasal sprays are insufficient, your doctor may prescribe corticosteroid pills or even a corticosteroid injection. These methods deliver a higher dose of medication and can be more effective in shrinking larger polyps. But what if these methods don't work? Well, there's still hope. If nasal polyps persist despite medication, or if they're causing severe symptoms, surgery may be an option. There are two main types of surgery for nasal polyps: polypectomy and endoscopic sinus surgery. A polypectomy is a simple outpatient procedure where the polyps are removed using a small instrument. Endoscopic sinus surgery, on the other hand, is a more comprehensive procedure that not only removes polyps, but also opens up your sinuses to prevent future polyp formation. Remember, everyone's body reacts differently to treatment, and what works for one person may not work for another. It's important to work closely with your healthcare provider to find the best treatment plan for you. With the right knowledge and care, managing nasal polyps is completely within our grasp. So, whether it's through dietary changes, medication, or even surgery, there are multiple paths to reclaiming your nasal health. In this video, we have learned quite a bit about nasal polyps. Let's take a moment to recap the key points from our discussion. We started by defining nasal polyps, those non-cancerous teardrop-shaped growths that form in the nose or sinuses. They're often linked to inflammation from conditions such as allergies, asthma, or infection. We've understood that while they might seem harmless, they're not to be taken lightly. Moving on, we delved into the causes of nasal polyps. It's not always clear why some people develop these growths and some don't. It could be attributed to a number of factors, including chronic inflammation, immune system responses, or even genetics. However, those with conditions like asthma, cystic fibrosis, or allergies are more likely to develop polyps. We then highlighted the impact of these polyps on a person's overall health. They can lead to a variety of complications, such as chronic sinusitis, sleep apnea, or even a diminished sense of smell. More than just a physical inconvenience, these conditions can significantly affect a person's quality of life. Shifting our focus to the anatomy, we identified where these polyps tend to crop up. They're most commonly found in the area where the sinuses open into the nasal cavity. However, they can also develop in other parts of the nasal cavity or sinuses. Lastly, we explored how to prevent and treat nasal polyps. Prevention strategies might involve managing allergies and asthma, avoiding nasal irritants, and practicing good nasal hygiene. When it comes to treatment, medical interventions like nasal sprays, oral medications, or even surgery might be necessary. But remember, there are also natural methods, such as saline washes and steam inhalation, that can help reduce inflammation and potentially shrink the polyps. So there you have it, a comprehensive look at nasal polyps, from what they are to how they can be managed. Remember, knowledge is power, especially when it comes to our health.